And so now we're going to turn to attention deficit hyperactivity disorder, or ADHD, and dyslexia. And it's important, and attention is intertwined with dyslexia for two important but very different reasons. So first, dyslexic readers are not automatic. To them, reading remains effortful. And I have referred to them as, quote, manual readers. And this means that they have to dip into and soon use up their reservoir bucket of attention in order to read, so that they become attention deprived. And as a result, they appear to have an attentional deficit. So after reading a short time, they become easily distracted. And second, there is a very large overlap of comorbidity between ADHD and dyslexia. So how does ADHD express itself in a student who is dyslexic? And let's talk about Sophia. Sophia was in the 7th grade and had been diagnosed with dyslexia. Her reading had improved dramatically with the help of tutors, the provision of extra time on tests, and her grades had also improved as well. At the same time, though, her teachers had noticed that she was becoming inattentive in class and was easily distracted. They described her as not being focused, not being able to follow instructions. These behaviors were also noted by her parents at home. And when they asked Sophia about her day, her mind would wander and she would take a long time to answer straightforward questions. And both her parents and her teachers noticed that she was often sidetracked when she was asked to complete an assignment or task, and would take a long time to do it if she completed it at all. And Sophia was disorganized at home, often losing or misplacing her schoolwork. And after many months without any improvement, her parents, with a recommendation from the school, sought a consultation with a child psychiatrist. And so this child psychiatrist spoke at length with Sophia as well as her parents. And with her parents' consent, she also spoke with officials at the school and gave Sophia 2 rating scales to complete and to help with the diagnosis of ADHD. The ADHD rating scale was 1, and the second was a Connors rating scale. And after reviewing the information, she told Sophia and her parents it was most likely that Sophia had a form of ADHD, predominantly inattentive type. And Sophia's parents were told that the co-occurrence or comorbidity of dyslexia and ADHD is quite common. And in our own studies, when we considered a sample based on children referred to a clinic for learning disability, 40% of children with dyslexia were also found to have symptoms of ADHD. And over 50% of the children with ADHD were found to have dyslexia. Again, I'm going to reiterate, that's 40% of children with dyslexia were also found to have symptoms of ADHD, and over 50% of the children with ADHD were found to have dyslexia. And the psychiatrist explained to Sophia and her parents that ADHD is characterized by 3 cardinal symptoms: inattention, impulsivity, and hyperactivity. And clinicians have come to recognize that the hyperactivity and impulsivity seem to track together, and inattention often appears separately. And then clinicians have recognized 3 different types of ADHD. There's inattentive, hyperactive or impulsive, and a combined type, where children have all 3 symptoms. And in looking at Sophia and her symptoms, she most likely had ADHD, predominantly inattentive type. And this type of ADHD is usually not apparent until the child is 8 or 9 years of age, and usually is lifelong. And the symptoms, according to the new DSM-5, include where an individual often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or doing other activities, often has difficulty sustaining attention in tasks or play activities, often does not seem to listen when spoken to directly, often does not follow through on instructions and fails to finish schoolwork, chores, or duties, often has difficulty organizing, avoids, dislikes, or is reluctant to engage in tasks that require more sustained mental effort and often loses things necessary for tasks or activities and is easily distracted and finally is forgetful in daily activities. It's important to know ADHD is a clinical diagnosis and caution that at present, while rating scales are helpful, there is no evidence-based test that will reliably diagnose ADHD. And the parents were urged to be skeptical of any measures claiming to identify ADHD despite claims of EEG measures or experimental psychological measures such as continuous performance tests. The psychiatrist also told Sophia and her parents that good interventions have been developed and that there is a long, successful history of therapy for ADHD, both using medications and behavioral interventions. And the main pharmacotherapy treatment options include stimulants, amoxicillin, antidepressants, and alpha-2 agonists. And the behavioral treatment strategy for children and young adults with ADHD includes working with the child, working with the parents, and working with the school. The child and the parents need to strive to maintain a daily schedule and reward positive activities, set small but realistic goals, and use checklists to help for the child to stay focused. And the school can also help by providing accommodations. These accommodations can include extra time to complete the assignments and taking tests in a separate room to avoid distractions. The school can also arrange to have the child sit close to the teacher and provide note takers to help her organize assignments and work. There are other behavioral treatment strategies as well. They include physical activity as well as mindfulness. In terms of the medications for ADHD, the stimulants begin to work immediately, and they include methylphenidate, which is Ritalin, and amphetamines such as Adderall, and come in both short and long-term preparations. And the short-acting preparations can last up to 6 hours, while the longer-acting preparations such as methylphenidate ER or Concerta or amphetamine, dexamphetamine XR or Adderall XR, and lisdexamfetamine, which is Vyvanse, can last from 10 or 12 hours. And then it's important to know, while generally safe, the stimulants can cause anorexia, they can cause growth retardation in children, jitteriness, and they can exacerbate existing tics and increase heart rate and blood pressure. And so in looking at the different classes of the meds, Strattera, or the amoxicillin, is a non-stimulant and is a class used to treat ADHD. And its mechanism of action includes increasing the amount of available norepinephrine. And unlike the stimulants, which work, the onset is immediate, it can take up to 2 to 3 weeks to begin to act. It can also last up to 12 hours and can cause dry mouth, constipation, and also it can cause headaches and palpitations. Antidepressants are a third class of medication options used to treat ADHD. As we talked about earlier, bupropion or Wellbutrin, as the selective dopaminergic reuptake inhibitor, is the most common among them. Its effects can last up to 15 hours, although it can cause seizures, hypertension, and increased anxiety. And the fourth class of psychotropic medications include the alpha-2 agonists, such as clonidine or catapress, which works by indirectly increasing the amount of norepinephrine, and their benefits can last up to 12 hours. Their side effects include low blood pressure, dry mouth, and sedation. And it's also classified as a category C medication, meaning that there can be some potential detrimental effects on fetal development. After careful consideration and review with her parents and psychiatrist, Sophia selected the long-acting stimulant Concerta and was prescribed 18 milligrams a day. She found the medication extremely helpful in helping her focus. Her teachers and parents noticed a positive change in her behavior at home and at school. She tolerated the medication very well, but did notice a decrease in her appetite and feeling jittery when she first started the medication. And because she took the medication in the morning, it did not affect her sleep. and she took drug holidays on weekends when there was no school, which she found helpful as well. And Sophia worked with her parents and the school psychologist on behavioral techniques, including setting daily schedules and making lists to help complete assignments. She was granted accommodations by the school, including extra time on exams, which she was able to also do in a separate room. And so it's important to keep in mind with all this that dyslexia often does not come alone, but rather is accompanied by either or both anxiety and ADHD. And this means that these conditions must be looked for in an individual who is dyslexic and treated.